Oh, two vaccines are being distributed nationwide. COVID-19 cases continue to surge in several states. Now we're hearing about new strains of COVID.
So should we be concerned? Well, this morning we're talking to Dr. Robert Amler, Dean of New York Medical College of Health Sciences and Practice. He spent 25 years working for the CDC. Dr. Amler, thank you for joining us.
Good morning, and thanks for having me.
All right, first of all, let's address the concerns here about the rise in COVID cases. We are seeing them spike up yet again. Hospitalization rates are up. Death tolls are up at this point. States such as California, many are attributing the surge to the holiday season. Can we get a handle on this, or is it going to be out of control like we saw in the beginning of COVID-19 back in early 2019?
Well, let me say at the outset, I think the overall outlook is very good, a lot better than it was in 20. And we're going to move forward with vaccines, with all of the measures that have been in effect now for several months that do work to some extent. And as we get more people vaccinated, things will improve. However, you're absolutely right that the holiday surge seems to have brought up the number of cases again. Deaths have not quite come up as much, and that's positive, although there are far too many deaths still. And we're going to have to wait a couple of weeks because, as you know, when somebody gets sick with this virus, they don't die right away, typically. So we may not see the deaths right away, but we have to still be very vigilant.
Of course.
This is no time to let down our guard.
Yeah, and thanks for clarifying. It's 2020, early 2020.
Oh, yeah. The post-holiday surge is a real thing. Like you said, it's a wait-and-see approach. But while we wait and see that, we're also hearing about this new strain, this COVID variant found in South Africa, this variant in the UK that's now here in New York, the 60-year-old from Saratoga Springs that we're reporting, the first confirmed case of the variant in our area. How much more of a threat are these mutations of the disease? Because we've had the FDA, CDC on, who've talked about strains and how things even like the flu mutate. But what do we know about this specific mutation?
Sure. Well, we know that viruses mutate quite a bit. It's their nature. It's what they do. Most of the time, that doesn't change things very much. In this case, it looks like, and we're still measuring, but it looks like this is a more contagious form, or at least seems to transmit more efficiently from person to person. That's a concern. At the same time, so far, that mutated virus seems to be just as susceptible to the vaccine as the other strains. Again, time will tell, but we can't let our guard down. Transmission can still be avoided by those 4 W's that we've talked about. Wear masks, wash your hands, walk away from groups, and watch the time that you spend with groups. Don't spend an entire evening or an entire afternoon with your friends and family.
Okay, I want to get to the fact that it's more contagious because we're seeing, as Dan mentioned, 2 different strains. If it is indeed more contagious, that means that these vaccinations need to ramp up. There's already concern about these vaccinations not rolling out as quickly. So what about the fact that some of these drugs, like Moderna, are saying, look, it doesn't need to be a two-term kind of vaccination. You can just do 1 shot, and that's going to be effective for ages 15 to 55. Is that something that we're going to see with other drugs?
An excellent point, because it has been shown that there is some immunity after that first shot. Would it be prudent to give that first shot to a larger number of people as opposed to getting everybody 2 shots before the others get their first shot? That still needs to be decided, and that really is an issue for the FDA. Because remember, it was their emergency use authorization that allows us to give the vaccine in the first place. And so that really needs to be adjudicated by the expert team at FDA. However, in the meantime, let's face it, the initial rollout has been disappointing, to say the least. Instead of some 20 or 30 million vaccines out there, we so far got about 4 or 5 million. And it's going to take a few more weeks for the system to sort of cut its teeth. If you forgive that expression, we're going to need to cut our teeth on getting a more efficient way to get the vaccine out to large numbers of people. And that still has to happen.
Yeah, and we're going to spend a lot of time this morning talking with a various number of elected leaders about the vaccine distribution. But I want to talk about this term, which we've heard a lot about, which is herd immunity. Herd immunity, you can get it through a vaccine. You could also just expose people to the virus, right, on a daily occurrence, all those people who are coming infected with COVID-19. What is the magic number for herd immunity that will start to eradicate the disease and bring down numbers?
I certainly wish I knew, and everybody wishes that they knew. For different viruses, it'll be a different number, and in different populations, depending on the interaction within that population, that's going to make a big difference. If people are pretty much staying at home, not interacting much, that number is lower. In populations where people frequently congregate, that number has to be a lot higher. So this is a number we do not identify yet. We'll know it when we get it, basically. And so in the meantime, we should vaccinate as many people as possible.
But for a place like New York, for just listening to what you're saying, for a place like New York where people would crowd on the subways and the buses, that number needs to be high.
It probably does need to be higher. You're right. But, I would much rather get to that immunity level with vaccine than to risk people getting sick with the wild virus and risk that they end up in the hospital or possibly even die.
All right, Dr. Amler, thank you so much for your time and your information. We do appreciate it.
Thanks for having me. Have a good morning.
You too.